Welcome back. On this page, we provide an overview of what to expect in the case report form. When you're entering information about the symptoms and treatments, it's okay to focus on those which most severely affected the patient's quality of life, or which the treatment had the most significant impact on, either positive or negative. While we'd welcome as much detail as you're willing and able to provide about the patient's symptoms and treatments, we know many patients with rare cancers have complex treatment histories, and that entering all of these details may not be feasible. Please don't let this dissuade you. Enter what you can and what you feel is most important for other patients, care partners, and clinicians to know. Remember that you can always save and exit at any point and return to your case later by clicking the Save and Exit button in the top right corner of your screen. You can find your cases again later by going to Account and viewing My Submissions. When you want to edit your case, click the 3 vertical dots, then click the pencil icon that says Edit. Note that your case automatically saves along the way whenever you click the Continue button. Therefore, if you ever need to find your case, even if you haven't clicked Save and Exit or Submit, your information will not have been lost. Visit your account and My Submissions to view your saved case entry. All right, we're ready to dive into the case report itself now. Start by clicking Continue at the bottom of the screen. You can navigate throughout the case report form in 2 ways, either by clicking the Continue and Back buttons at the bottom of each page, or by using the left menu bar to move between sections of the case report form. We begin by asking about the patient's demographics, such as their age at diagnosis, the sex they were assigned at birth, the country the patient was treated in, and their race and ethnicity if the country was the United States. Let's say that the patient was a 7 to 12-year-old male, and that they were treated in the United States, they were Asian, and not Hispanic Latino. Select Continue to move to the next screen. Here we ask about the risk factors that the patient may have had that may have predisposed them to developing a rare cancer. Select all that apply, enter something in the Other free text box, or select that the patient had no known risk factors. The following pages ask about the patient's disease presentation. This includes the primary location of the sarcoma or rare cancer on the patient's body, whether the cancer was localized, locally advanced, or metastatic, and the sites of metastatic disease if it was metastatic. The next question asks you to describe how the patient's rare cancer was diagnosed. What year were they diagnosed? How long was it between when they had a first encounter with a healthcare provider and when they received a diagnosis of a rare cancer? You then have the option to enter signs and symptoms that the patient experienced when they were diagnosed. On the next page, you will be able to, all right, on the next page, you'll be asked whether the diagnosis was confirmed by biopsy and or tumor resection. Then you'll be asked about whether genetic testing was performed, and if so, what the mutation was that was detected, whether it was somatic or a germline mutation, what type of genetic test was performed, and if you can, specify the molecular alterations that were detected. Next, you'll be asked whether the patient was seen or the case was discussed at our sarcoma referral center listed by SARC. Tune into the next video to enter the lines of therapy and the outcomes experienced with treatment of the patient's rare cancer.